All right. It's 5 o'clock, that time every day that we as Kentuckians come together and remember that we will get through this. We will get through this together. Say it with me because we believe it. We will get through this. We will get through this together. And one more time, we will get through this. We will get through this together. And we are going to get through this in a way that will be the envy of just about every other state in this country, because each and every one of you out there is working your hardest. We have come together as a people. We have ended those divisions amongst us. And we have agreed that we will pass this test of humanity, that we care more about each other's lives and each other's health than our own personal financial well-being. This generation, you as Kentuckians, I believe will be an example going forward about the people that we truly should be. One Commonwealth for the common good, and I could not be more proud to be your governor. We always say we're going to get through this, and we're going to get through it together, but it's always good to hear other people saying it too.
Words of our governor.
We will get through this together. We are one. We are one.
All across this Commonwealth, we see people that not only say it, but believe it. And that we know while the days are going to be long and the weeks are going to be long, that we're looking at months, not years, and we will defeat this virus. And we're going to do what it takes to make sure that our parents, our grandparents, and so many other folks are here with us after this. We are performing. We are flattening the curve. We are saving lives. We got to stay strong and stay resilient so that we make sure we don't give up halfway, that we don't start looking ahead so much we stop doing what we need to do right now. We're going to get through this, and we're going to get through it together. And we're going to get through it because we're going to follow the 10 steps that it takes to defeat the coronavirus. Number one, I talk about every day. Stay at home. Healthy at home is where you can do your best to make sure you and your family don't contract this virus. And it's where you protect our frontline healthcare workers and our first responders. Anytime we're not at home, it ought to be just to get supplies to go to work or to get some exercise. Healthy at home protects other people. Remember, a decision to go to a mass gathering or to not follow the rules, it might not ultimately harm you. It might not harm a member of your immediate family. But you could be asymptomatic, and a lot of people are, and you pass it to somebody else who passes it to somebody else, and somebody dies. That's just the stakes of what we're faced with, so let's make sure we don't, based on our decisions, put anybody else in harm. And for the vast majority of us, we are making those correct decisions every day. Remember, do not travel at all. kycovid19.ky.gov is the source for information. We're going to talk about benefits here in a little bit when we get an unemployment update, and then your mental health. I will tell you, I mean, if you tuned in a couple days ago or maybe the day before that, we all struggle, right? And I hadn't slept much in several days leading up to probably a couple nights ago. And I know that's happening to you too with anxiety and the difficulty of getting through this. But it's important that we stay strong so that we can make good decisions. And that when we know we're struggling a little bit, that we do what it takes. We get the rest. We talk to friends, that you get the help you need to make sure that you are in a good place. We want to come out of this stronger, mentally, emotionally, and physically. We want to come out of this stronger. Knowing when to seek care is going to be critically important. I know you all know that. It's about, if you're nervous but well, calling the hotline. If you are sick but wouldn't have sought care, call, don't go to your healthcare provider. But last, if you need help, make sure you get it. There are just a couple of examples out there of folks that might not have sought help early enough. Make sure if you are truly sick that you are getting the help that you need. We always talk about our top 10. There's also the +1, and that is make sure you fill out your census. We saw a lot of folks on social media after yesterday saying, I finally filled out my census. This is your legal obligation. It's against the law not to fill it out, so make sure you fill it out. And it's also going to be a huge part of our rebuilding effort. James, do we have the dashboard update for today? Here it is. This gives us the national response rate. It also shows where we are in Kentucky. We are still this is from 4/8, so this is the last one. Let's do an update tomorrow, and let's make sure we are well over that 50% mark. Let's make sure we are working towards being at least in the top 10. So tonight is the last opportunity before we show it tomorrow for everybody to sign up for that census. We need your help. You got to do it anyways. Let's take pride in how we're doing it. We also ask you every day to fill up social media with positive statements, because you see a whole lot of people out there that don't believe this coronavirus is real. They don't think it's killing people, and they try to spread messages that are harmful to us. And we know, and the federal government has talked about it, that we also have folks that want to undermine our national security, that try to drive that try to fan those flames and try to create discord amongst us. We can't let that win. We have to continue to let our positive examples shine out there. So here's a little bit of what we have today, again, using these hashtags that we ask people to use. All right, this is LaRue County EMS, who are going to be wearing green shirts throughout the remainder of our fight against COVID-19. These are our folks on the front lines. We should be showing compassion for them. They're showing compassion for everybody else. We talk about this needing to be a time where we are kind to each other, where we are good people, where we are understanding of other people's anxiety. This is going above and beyond. These are folks that face the anxiety every day of contracting the coronavirus, and they're showing their compassion for others. So thank you, LaRue County and your EMS. This is Bath County, again, lighting up their courthouse green, the color of compassion. And we went over 100 deaths yesterday, and we have some more today. So our flags are flying half staff at the Capitol. We ask others to do that too. But more importantly, these green lights have become a symbol of our compassion, that we care about every single Kentuckian, and that when we lose one, we have all lost. So let's continue more and more every day to light them up. Here's Bowling Green, and that's Judge Mike Buchanan, who has been working really hard in Warren County. We have had a lot of positive discussions. Mike and I, before this, people might have said that we were on different sides of different things. There aren't any sides anymore, and he'd say the same thing. Not Republicans or Democrats, not liberals or conservatives or moderates, just Americans versus this coronavirus. He and so many other county judges are living that out. And any noise that's out there when people try to create divisions, just push it out. Just push it out. People's lives are on the line. We're not playing around. This isn't a chance or a place in time for people to make political statements. And none of that. None of that. And our local officials are leading the way. And here is Western Kentucky, Central Parks. Again, this is Murray and Callaway County, lighting up green to honor people. Okay, so again, this is a fist bump in a nursing home. Remember, anybody who holds a mass gathering or doesn't follow the rules, they risk the people we're trying to protect, the most fragile, those that this coronavirus comes for, and it does. It is incredibly deadly to our senior population, especially in long-term care facilities. So let's make sure that our actions don't result in harm to those that are absolutely counting on us. Look at this. This is our next generation caring for this generation. Our kids, and they're going through a lot. And by the way, parents of children, especially young children, are going through a lot. It is hard, and thank you for everything you're doing. But I think our kids continue to show amazing examples, to try to find the positive or the joy in it, if it's chalk art, in listening to the messages and truly wanting to help society to doing things like this. So thank you to Taylor Puckett. Just a little more. So this is a child of this healthcare worker, and what he or she is saying, Ryan, is that the best thing you can do to protect his dad is to stay at home. We're supposed to care about those that care for us, that walk onto the front lines every single day, knowing that they could come down with this virus. The very least we can do for them is to stay at home. So let's do it. All right, so every day we have also started a new tradition. It started with Virginia, and the fact that, actually I think she made the original call, asking to be able to come so that everybody could be included. And so we're learning a little bit every day on how to include others. So she's going to teach us a little bit today. And I don't know what you have planned, but at some point, you got to teach us we can't be doing that. Here's Virginia.
Because it's also so important. Social, this is social. These are people gathering around. Distance. And that is that you're not so far apart you can't see each other, but you have to be at a distance. Social distance.
One more time.
Social distance.
Well, thank you, Virginia, and everything that you are doing. All right, let's talk about where we are, and let's start with the Kentucky map from our website. It's important that we start by saying that this coronavirus is incredibly contagious. It is all around this Commonwealth. It's in every county, whether we've had a report or not, but it's only now a handful of counties, if you go on the website, that you'll see don't have a reported case. We've got to pretend, it's not pretend, we've got to act like all of us already have this virus, because I haven't talked about it in a while, but we have two duties. Number one, to do everything we can not to get the virus ourselves, but number two, to never do something that would infect other people. And if we act like we have it, then if we're asymptomatic and do have it, that we won't be spreading it to others. And so it's making sure we're cognizant of all of our actions, but mainly we are healthy at home. Here it is. I mean, look at how it's changed. Look at it. This is how serious this is. Very few white counties. Those are the ones that don't have a confirmed case yet, but coronavirus is there. And then now look at all of the red counties. And we'll add more red counties as we move forward. So every part of Kentucky has to do their part, and we are seeing that. I mean, even a number of our counties in eastern Kentucky, before they had a case, their local officials were working hard. Were doing everything they could. They closed down some playgrounds where people weren't engaging in social distancing. I'm very proud of their efforts, and I believe this map would look different. All throughout it would look different, but for the actions, first of all, of you. Of you. You have bought in. You are doing your part. You are passing that test of humanity, but the test isn't easy. The test is long. And we got to make sure that we do what it takes to get through it. But let me tell you, you got an A at the moment, but the test is going to last a lot longer. Let's make sure that we continue with it. And just to remember a little bit of what the stakes are about, let's look at the COVID Act Now slide. That shows us, here in Kentucky, what the difference could be and how many we lose if we engage in really good social distancing versus if we don't. And I'm going to step over here. This is no mass gatherings. This is everybody on board. And this is some people not doing their part. It shows you that we can protect each other. And my hope is, from what we're seeing out there from the modeling, that these numbers are actually lower on both ends. I certainly hope that with what we are doing right now, we will be under those 2,000 deaths. But whatever it is, the ratio will be about the same. So let's say what we're doing and how we flatten the curve, which I believe is hopefully at the end will be some of the best in human history. Let's say it's under 1,000, 50% of that. Okay, that would say it's the difference between 1,000 and 6,500. Aren't 5,500 Kentuckians worth it, even if the model is different? I believe they are. And that's why I fight every day, and that's why I know that you do too. And regardless of some of the other things that are being talked out there, understand that we are on the slope up. We have not reached the top, and we aren't on the way back down. I know there's a lot of talk right now about reopening and the rest, and we'll give you some of our standards for that in the coming days, even though I've talked about them in the same way that other governors across the country are talking about them, which is all just what it would take. And remember, it's a public health decision on when and how we can open up. And that's because it's about how the contacts are spread and where the virus is. That it is a public health decision. That's the difference between life and death on how we do that. But I just want to remind people that we are on our way up, and there will be a point where we are on our way down. But let's make sure we are more committed to the fight right now than anything else. All right, let's give a couple of updates. And the first one is some pretty incredible news. The Team Kentucky Fund, which we're going to go through tomorrow, but a fund that we've created that has oversight from the state that ensures that dollars that people want to give can go to those that need it the most. Things like rent and utility type help. We've had a great response. And tomorrow we'll walk through a whole lot of our donors, but today I just wanted to mention the Kentucky Colonels, the Honorable Order of Kentucky Colonels. They are a group that has done incredible charitable work throughout their existence. As governor, I get to honor people as Kentucky Colonels. But this group and organization goes above and beyond, and their sole focus is Kentucky. So I'm proud to announce that they have given our biggest contribution to date, contributing $1 million to the Team Kentucky Fund. Just think about how many people that's going to help. And we'll announce a lot of others that have done a lot tomorrow. We'll see the Lieutenant Governor via video tomorrow. We try to not be in the same room together, but this is pretty special. Thank you to the Kentucky Colonels and all of their work. They are a huge part of Team Kentucky, and now they're the single largest donor to the Team Kentucky Fund, and that means many of you out there are going to get a little bit of extra help because of them. All right, testing update. As you know, we've got a couple of different areas of testing we're doing right now. We had the first kind of state-run contract with Gravity Diagnostics, intending to increase testing capacity about 2,000 a day, which we're still ramping up to. That's being administered by hospitals throughout the state, and it's been incredibly helpful. But the second one we announced with Kroger. Kroger stepping up as a great corporate citizen and certainly a large presence in Kentucky, and they are providing personnel and PPE all on their PPE and all on their dime to do drive-up testing in Kentucky. Right now we have a goal of 20,000 tests. We're trying to get as close to it as we can, which would almost double where we are right now. We had our first site open up, which was Frankfort. This is day 2 of Frankfort. They did 178 total tests today, or at least as they were approaching 4. That was their number. That is up from yesterday. We believe that we are going to reach that capacity of 200 150 each day. This was day 2. The Frankfurt site is going to be open 2 more days. The Kenton County site opens on Wednesday. It will be open for 4 days with a goal of 1,000 tests done on that. We're going to announce some new sites on Thursday because we have more opportunity here with what Kroger is doing, and I'm excited that some of these sites are going to provide more testing to areas that have needed it. This is how you sign up. There are the 2 ways. So if you are in Franklin or a contiguous county, any county that borders Frankfurt, you can sign up, and you should sign up. Let's do 500 tests between tomorrow and the next day at this site. Let's make sure that we get it in. And remember, there are a couple of tiers or priorities that you can sign up for. Number 1 is if you are a first responder or healthcare worker. Number 2, if you are 65 years or older or have a chronic health condition. Or tier 3, which we don't have on here, is if you are symptomatic. The worst that can happen if you go to the website or make a call is that they say that you don't fall into one of these tiers. So you might as well, if you fall into any, or if you think you fall into any of these 3 tiers, sign up. I want to make sure we get as close to those 500 tests. And also for Kenton County and the bordering counties. So if you were in Campbell or you were in Boone, make sure that you are signing up for what will start on Wednesday. And again, if Wednesday already has all the appointments, they will roll you into another date. Let's make sure we are taking advantage of it. All right, PPE we're going to run through today. PPE is the personal protective equipment. This is what our healthcare workers and our first responders need so that when they help those that are infected with COVID-19 or might be infected in COVID-19, they have their best defense against it. 3 ways that we acquire PPE in the Commonwealth. Number 1 is to buy it. That is incredibly hard right now. And I would tell you, if it was easy to buy it, we would have millions upon millions of pieces of PPE right now, which we don't when you'll see it. I would have bought 10 million of every single piece by now because ultimately throughout the course it would probably be needed. But it right now is incredibly hard to purchase. Just about everything is going to FEMA or is otherwise being directed by the federal government primarily into hotspots right now. Number 2 way is manufacturing it. And I will tell you that we are getting more and more from this route. Now, it's required people to change their systems, and so that's taken time. It's also cut down a little bit on how much we can get it out. But all the stories you see on face shields right now, which is one of the areas that people have been able to address the most, that's our manufacturing capacity. But number 3, and I believe that this has been some of the most significant, is to donate. And let's put up the slide on how you donate. Kentuckians, you are coming through. And I will mention in a minute, especially some of the areas that you do. But if you have any of this PPE, we need it. But it's not we. Our healthcare workers need it. And when you send it to us, it means that we have a supply that can go out to those that are running out as we track where they are and how much supply they have. Your local healthcare providers need it too. But here's the way to donate it to the state. GivePPE.ky.gov or 833-GIVE-PPE. So again, incredibly important. All right, here's what we have on hand at the moment, and this is dynamic as we have had better luck purchasing, especially in the last couple days, thanks to help of different groups out there. This is what PPE is, but if we can get to the numbers of what we have on hand, I want to go through that piece. Well, there it is. So, first of all, when you look at these numbers, none of them are enough. And Dr. Stack's going to talk about that. We are low, just like every other state is low. 4.2 million gloves. A lot of this was donated by you. The gloves are all different types. The nitrile medical gloves are the best, but right now we will take what we can get. We have 355,000 surgical masks, over 153,000 face shields, 37,000 gowns, that's the protective clothing, and 279,000 respirator masks, of which 130,000 are the N95, 145,000 are the KN95, and right now over 5,000 coveralls. Not enough. I want to be transparent about where we are, why we need more, and why we're fighting for more. And hospital systems would tell you that this wouldn't last long, but the point here is to help the long-term care, the hospitals, the other folks that are going to need it at the point when they are the most desperate or their stock has gotten the lowest. I want to ask Dr. Stack to come up and not only comment on really what this means, because these are numbers that you need a little context with, but also how we will make decisions on where it goes. Dr. Stack.
Thank you, Governor. So with these figures up here, I think it's really important to remember that virtually all of these, or all of them, are disposable, and so they're intended to be used once and discarded. So they look like big numbers in some areas, but normally when we operate in a hospital or a healthcare setting, you're required to use these disposable items for one patient to minimize infection spread for other causes, but we've now had to ask healthcare facilities to reuse what were previously disposable items. So for the N95s, which are some of the hardest things to get, if you use one N95 for one patient and toss it away and use another one, you go through that very, very quickly. Now we've had to have, in some instances, nurses or doctors who use them for the entire shift or even multiple days at a time. It depends where you work. Some facilities aren't hit as hard. If you're in New York, I'm sure that there are people who have been really stuck having to reuse these a lot. So, and some of these numbers have just recently begun to get a little bit larger, and now this will all be pushed out to help support hospitals, nursing homes, first responders. Oh, that's the other thing I have to draw your attention to. There's over 100 hospitals. There are hundreds of nursing homes and assisted living communities across the state. Then you add all the police, you add all the fire and EMS ambulance crews, and then more. So there's enormous number of people who need this material to keep themselves and the patients safe. So I'd like to just talk about the process for how this gets distributed a little bit. So first of all, I have a letter from the Vice President of the United States that requires, this is an April 10th letter. Now, under normal circumstances in emergency, you're required to report certain information in order to get materials. So that's not unusual. So there's no criticism implied by that. The level of detail required is really unusual, though, for the coronavirus response. Because the entire nation needs these resources, the federal government is requiring that we report every day on a single facility-specific level all the inventory they have on hand. This means if you want materials, if you're a hospital, if you're a nursing home, if you're first responders, we have to report what you have on hand, how quickly you go through it, so they can calculate what they call a burn rate. And if we don't report that, we don't get the materials from the federal government. So, and that's how they determine where the hot spots are. So when using this, we have to report information for laboratory materials and for personal protective equipment. Once we report that every day, and the way we've done it in Kentucky is we've asked you to report to our centralized computer system, and then we send one report up for the entire state. So every facility who wants to get any PPE or laboratory testing stuff from the federal government, but in this case the PPE, you must report by 10 a.m. every morning to WebEOC, which is the software program that we use for this. We then get daily reports which give data like this that then go to the governor, so he's aware what we have on hand and how we've been successful trying to get materials or where we haven't been successful. And quite frankly, it's been challenging to be successful. We're going to have some victories, we hope, in the coming days and weeks, however. Once we do that, we send the reports up to the federal government, and then we have teams that have members of the Kentucky Department for Public Health, Kentucky Emergency Management, also the Cabinet for Health and Family Services, who review these detailed reports and make very, very difficult decisions about how to distribute this personal protective equipment. And we have a tiering system that goes through hospitals and long-term care facilities, EMS, shelters, places that have multiple COVID-19 patients, then similar criteria that has a single COVID-19 patient. Then we go to all other healthcare facilities and providers who need it. And then there's a fourth tier which captures everybody else who might need access to it. I will tell you that the team spends a lot of time. It is a difficult decision-making process. They try to be dispassionate and methodical about it. They're doing the very best they can to distribute the resources where it appears they are most needed. But we can't give the resources out unless everybody reports every day. And the level of detail is really quite specific. We need you to help us with that, because if we want to get resources from the federal government, we have to report that every day. Thank you.
Thank you. All right, next up, and let me just, before we leave this, say we need a lot more of this. And we're working really hard on it every day. And we got a lot of people working hard on it, from our emergency management group to others. My Deputy Chief of Staff, Jonathan Smith, has had some real success, especially the last couple days. We appreciate everybody who's out working to make this happen. All right, next up, and I know it's critically important to so many Kentuckians, is an unemployment update. We are processing more claims than ever before and sending out more payments than ever before. But I know many of you out there still haven't gotten the service that you need. That is our fault, and we are working through it. We will help. We will get to you, and we will explain the glitches as they come in a transparent and honest manner. So, Josh Benton.
Thank you, Governor. Just a couple of things we'll do today is overview just some of the numbers of claims and payments and that sort of thing. But as the Governor mentioned, specifically those folks that haven't received a payment yet, we'll talk directly to them just to let them know where things are in the queue, and just with the struggles of not everybody being able to get someone on the phone. We'll talk about where the majority of those issues are. So the first thing we'll look at is the number of claims. We'll start here with the issues. So talking to, there we go. Back on track. So the number of claims. So we've mentioned, March 16th is kind of our measure of when we saw the rapid increase of unemployment insurance claims. And you see there over 520,000 claims that have been filed since the middle of March. We're still averaging around somewhere between 14,000 and 16,000 claims a day from that time period. So a significant number of volume that we're processing. The payments have been almost $150 million in total payment of claims to over 450,000 people. Now, all those 520,000 have not yet been eligible for payment yet, but we've made payments on over 450,000 claims. The $600 a week additional that we started last week, just to give a little bit of update on those numbers, those payments have been made to, as you see there, over 156,000 individuals, and almost $140 million in those payments. We're still playing catch up from getting that information, but those are being processed nightly. So folks that are on unemployment insurance, they don't have to do anything different. They're going to receive this additional $600 a week. So now talking to the folks that still haven't received their payment, their initial payment in particular. So one of those reasons, and the vast majority of folks fall into this category, is that your 13 to 15 day window since filing hasn't closed yet. Just a reminder to folks that after you file a claim, that first payment comes automatically, typically within 13 to 15 days. There's no need to request payment or to refile if you don't see it right away. Most of you are still in that time frame. Here are a few other reasons where the vast majority of people are falling, and I'll talk about what we're doing to get those cleaned up. So The first group are those that have requested a claim but went ahead and requested payment or refiled a new claim. And we understand why that happens. People don't see the funds right away. That's my inclination is if I don't get something as soon as I think it is to do it again. And so that's what a lot of folks have done. We're cleaning that up so that can be fixed as quickly as possible and you can get your payment as soon as possible. The third piece is identity verification. This is something we take really seriously to prevent fraud and identity theft. And so there are security questions that everybody has to answer. In some cases, we have to request additional ID in those cases. So you have heard from us if you need to provide that, and once we have it, we're processing it so we can get that claim out. The last piece is what takes a little bit longer, is if the claim is under investigation. And really, investigation is a strong word, but that just means it needs a little more review. And so there's a few things that come into play there. One is an employer protest. So if you say that you've lost your job, but your employer has the right to verify that, and if they say that they have a conflict, we have to review that and sort that out before we can process the payment. We're not seeing as many of those right now, but that's still something that's going on. Another issue is that it maybe is missing information. And we'll reach out to folks if it's missing information to get that cleaned up as quickly as we can. And a couple of other issues that are a little more complicated is if it's a multi-state claim. So if you've worked in multiple states, we have to work with that state to verify your wages and that sort of thing before we can make the payment, and the payment comes after that gets worked out. And then it could be a past unemployment insurance issue, like an overpayment or potentially a fraud issue that we just have to get cleaned up and verified before then. So we're working through these as quickly as we can. Some good news is that we're adding more folks to the phone every day to help with these. But I wanted to provide this information so for those folks who haven't had a chance to talk to anybody, just to know you most likely fall into one of these categories. We're working through them as quickly as we can, I promise you that. We answered more phone calls today than we have since this began. By the end, we're well past answering 20,000 calls today. That's more than we've been able to do. It's still not enough. We're still adding capacity, but we're making progress there, and it's our commitment to get to everybody as quickly as we can and get their issues resolved. Thank you, Governor.
All right, so we're working to do better each and every day. I really appreciate the job that the Education Cabinet and workforce has done, but if you haven't been helped yet, it's not enough. We're going to keep at it, and to everyone out there that is anxious and worried that their payment won't come, that's having to wait too long, it's on me. I'm your governor. We will work, and we will work, and we will work to make sure that you get what you need to get through this crisis. All right, let's go to our update today. So yesterday, we had under 100 cases, and looking at it, while we were happy that those were the numbers of the day, we believe that it was probably an aberration, and that the next day would catch up for it, and it has. So today we were reporting 177 new cases, and again, every day we go through to remove duplicates and folks from other states, because remember, a lot of our hospitals are also helping people from other states. So with 177 new cases, with duplicates or folks from others removed, our total number of cases the state is reporting is 2,210. We have now tested 27,697 individuals, and that is a pretty firm number because we now call through every single lab that reports to us. If they haven't given us that number and we don't have the total, our National Guard has been helping out with that and has been a big help. Now, every day we learn about new labs, and oftentimes by the time we get to them, they've conducted a number of tests, so this is a firm number pending any new lab that's out there or that hasn't been reporting to us. We know that at least 687 people have been hospitalized since the beginning of COVID-19. 305 people are currently hospitalized, at least. Ever in the ICU, at least 263. Right now, at least 137. So let's think about those folks. They call it an intensive care unit for a reason. Now, most people who are going into intensive care are coming out, and that's because our healthcare professionals and our hospital systems are doing an amazing job. In fact, they have really beaten the model on how many days somebody was going to be hospitalized that has this, and that has gone a long way in helping our healthcare capacity. It's not just flattening the curve, which we have, and they would tell you that we have. Everything that they and their doctors and everybody else are doing, and all of you that have gotten this virus, that have been able to ride it out at home. You all are the reason that we have the healthcare capacity we have right now. We got to keep it up. It might sound like we still have a whole lot of beds, but if this thing spikes in ways that it has in other places, we need to make sure we have them. Our Kentucky citizens right now are doing what it takes to make sure that we have the beds and the ICU beds and the ventilators that our sickest Kentuckians will need. In good news, over 653 Kentuckians have recovered, including 2 now from Western State Hospital. That's some really good news today. In tougher news, we have 11 new deaths. Those are 11 Kentuckians whose families and communities love them. One loss is a loss to all of us. Since we passed 100 yesterday, we've been flying our flags at half staff here in the Capitol and keep lighting up your homes. We're now at 115 total deaths. It's 115 too many. Let's make sure we do what it takes in honor of these 11 families and others, and I'm going to mention a couple of specific people here in a minute. If you are one of the families of these 11, we are thinking about you, and we commit to you that we're going to protect other people out there, that people shouldn't have to go through what you're going through. And those that just see and hear this as a number, imagine what it would be like to not even be able to attend a funeral of a loved one. Now, I remember all my grandparents passed away now a long time ago, but I was able to go to those funerals, and to imagine not having that closure is incredibly difficult. New cases by county, and again, remember our reporting times are a little different than some of the counties, but 48 in Jefferson, 15 in Kenton County. This is why this is our next site that we are opening up. They've been hit hard. They're one of the red counties on that map. 14 in Fayette, 11 in Jackson, 7 in Boone, 6 in Hopkins, which continues to be hit hard, 5 in Logan, 5 in Warren, 4 in Campbell, 4 in Graves, 3 in Bullitt, 3 in Spencer, 2 in Boyle, Butler, Christian, Corbin, Davis, Greenup, Laurel, McCreary, Muhlenberg, Nelson, and Webster. And then 1 in Anderson, Barron, Boyd, Caldwell, Casey, Edmondson, Garrett, Grant, Hardin, Henderson, Jessamine, LaRue, Leslie, Lincoln, Livingston, Lyon, Madison, Marion, Marshall, Mason, McCracken, Monroe, Russell, Shelby, Simpson, Todd, Wayne, and Woodford. It's everywhere, right? I mean, I know we've got a couple of counties, at least I believe, for the first time here. But when you hear that list, let's remember that it's in every county that's out there. Our new deaths, at least reported today, are an 84-year-old male in Jefferson, a 61-year-old male in Laurel, a 74-year-old male in Jefferson, an 88-year-old female in Campbell, a 50-year-old female in Adair. And this is our first healthcare worker, it's a nursing home worker, to my knowledge, that we have lost. An 89-year-old female in Campbell, a 68-year-old male in Kenton, an 87-year-old female in Kenton, an 89-year-old female in Jefferson, a 76-year-old female in Lincoln County, and an 87-year-old female in Jackson. We are thinking about all of you. And I'd mentioned before that when folks out there want us to share, first I want to honor the families that don't want us to share names, and your mourning you ought to be able to do the way that helps you deal with your grief the best. but a couple of families have shared. First, let me talk about our first healthcare worker death here in Kentucky. It's a 50-year-old female, a med tech at Summit Manor Nursing Home in Adair County. She's in good health other than one comorbidity, and we have lost her based on her service to others around her. It's noble. It's really special. And we ought to not only honor her, but think about everybody else that's in her situation that is going into facilities right now to care about people. So for everybody out there that says, this isn't real, this person gave their life to protect others. Also, tonight, I wanted to share the story of Joyce Scobie, who was 75 years old in Meade County. So every day, we give numbers. I give numbers. I read the age and the gender and the county of people we've lost, but it almost doesn't sound real. I know to many of you out there, I will tell you it's very real to me every day. But every single one of these folks, like Joyce, as a child of God, with a family that cares for them and a community that knows them so well, and every single one is a loss. It's devastating. Joyce and her family are the perfect example. Jeff D'Alessio of the News Enterprise wrote a story working with their family. It paints a picture of a sweet woman with a big smile, a bigger heart, and a great laugh, who was deeply committed to her families and friends in church. She was a second mom to so many. I know what that loss feels like. I lost my second mom about 4 months ago. It hurts. Laura, one of her children, said she loved everyone and everyone loved her. Joyce was lost on Wednesday, and so our heart goes out to her children, her grandchildren, her church family, and her community. Her family wanted us to share this because, number one, they wanted to honor how special Joyce was, but number two, they want to make sure that other people don't go through what they are going through. Remember, when we don't follow the rules and guidelines, when we flaunt them for whatever reason, people like Joyce are taken from us, and while she has gone to a better place, they're taken from us here on earth forever. That our choices might not impact us, but how much is your choice worth it if it can cause the death of somebody else? So, Joyce, we will miss you, but we will see you again. And to your family, we will do everything that we can to support them. Breakdown of race and ethnicity. We know 72.18% of cases, the racial data. Total cases, it's 81.03% white, 11.23% Black or African American, 2.96% Asian, and 4.41% multiracial. Now, on ethnicity, we only know about 58% of cases, and those are 93.68% non-Hispanic and 6.32% Hispanic. Deaths, again, show a disparity that we have to address in our healthcare system, and it's based on decades, if not more, of inequality within our healthcare system and so many other factors. So for 83.48% of all cases, inside of that, 76.04% of deaths are white, 22.92% are Black or African American, and 1% is Asian. Of ethnicity, 98.92% of deaths are non-Hispanic, and 1.08% are Hispanic. We have data for about 80% of known deaths. All right, let's walk through a couple of the facilities and areas that we have been giving updates on. The Green River Correctional Complex. The good news is that we have no new cases to report today of either staff or inmates, but we do have one positive case of a an administrator or of a staff member at Rotorua Correctional Complex in LaGrange. Again, it's just one staff member. To date, we don't have any positive tests of any of our inmates or additional staff members, but that is the first staff member at a different correctional institute, state correctional institute, that has tested positive. Western State Hospital had not changed yesterday, but remember we are in the midst of 130-something tests, not all of which are in, and they're all of staff in this instance. So what they wanted to make sure is within this facility that they knew, especially from a staff standpoint, who would test positive so that they weren't spreading the virus inside the facility. So we have 3 new cases, all 3 of which are staff. There were 16 yesterday. There are 19 today. We do expect there to be some more just based on how much testing we're doing. And what we find is when we do a lot of testing that there are a lot of asymptomatic people out there. And I think that that is the same all around the country. Long-term care facilities. This is the challenge of the coronavirus, and this is what it does. It comes for our parents and grandparents, though we lost a 50-year-old healthcare worker. So it comes for much more than that. But the most vulnerable is where it hits the hardest. We've had 35 additional residents of long-term care facilities test positive. We have had 10 new staff members test positive. And we have had 3 additional resident deaths and our first staff member death. We are working on this every single day. This is what Dr. Stack now does. We have created a task force. We have some of our healthcare hospital systems working directly with these facilities. And then we're going to have some more news in the coming days about additional steps that we are taking. Let's remember that not all of these facilities are the same. You have a facility like Trayton Oaks where the residents are particularly fragile. You have other facilities that may just be assisted living facilities. We have some that have been hit pretty hard, but by and large, the residents are doing pretty well. And so all of that creates a very complicated decision-making process depending on the facility and the shape that people are in once these tests come back. I will say that the amount of tests being run in our long-term care facilities has increased dramatically. The amount of resources being put towards them, which is the correct use of resources, has increased significantly, and we're looking at ways that we can do even more, and we're looking at ways where we can help the staff, too, of these facilities. So your number one concern in these facilities are residents testing positive that may be fragile and may need additional care. Your number 2 concern is whether or not you're going to have the staff to come in and help the folks the next day. Because remember, without proper staffing, we could lose more people in one of these facilities than the coronavirus might otherwise take from us. So both are incredibly important, and we're trying to address both of them as we move forward. We don't want to see what happened, at least at one California nursing home facility, where nobody showed up one day. I mean, that cannot happen. That harms so many people. So we've talked a lot about other types of frontline healthcare workers. These folks, this staff, they're heroes too. They're heroes. They don't just show up every day knowing they could contract the coronavirus. They show up every day trying to protect the most vulnerable. And this is why before we ever had one case, weeks before we had one case in any of these facilities, we cut visitation entirely. It was hard at the time. But these numbers would be significantly worse if we hadn't made those decisions. All right, we'll open it up for 10 to 15 minutes of questions. We have Joe, Daniel, and Phil with us today, and I've got just a couple of questions that have come in. So we'll start with Phil.
Senator Damon Fair said today that the rural hospitals are hurting. They've had to lay off a lot of people. Would you consider allowing some of the rural hospitals to do some elective surgeries so they could help some of the employees that are losing their jobs?
Well, the question is apparently from majority floor leader about wanting to do elective procedures again, I guess especially at some of our rural hospitals. Elective procedures all require PPE. PPE is the only thing that protects our healthcare workers that are taking care of patients that have COVID-19. It's the only thing that protects these nursing home or long-term care employees that have it. And with the nation being critically low on PPE, we can't do that. In fact, the president and the White House in their recommendations long ago said cease all elective procedures. We've done that through a mandate here in Kentucky. It was absolutely the right decision. Question here from Valerie Spears. Has the governor made a decision on extending the statewide school shutdown? The answer is not yet. We'll be talking to the education community at the beginning of next week. And certainly we are still on the increase. We believe in this virus, and that will be a big part of the decision that we make about what the next steps are. I think schools should at least prepare plans for us not being open for the rest of the year. Joe.
Well, some Democratic governors of states in the West and Northeast have outlined a regional plan aimed at coming up with some kind of plans to ease COVID-19 restrictions at some future point.
Right.
Have you considered doing that with states like Ohio and Indiana, and have some of those discussions already begun?
So the question is, there were, I believe, 2 groups that announced that they'd all be working together on what they call plans to reopen, but what they really are is coordination of when to ease restrictions and to allow more contacts. When you reopen certain things, mainly looking at it from a public health standpoint. And the reason that they're coming together is if they don't do it in lockstep with your neighboring states, we can see what we believe we saw from Tennessee, which is individuals that don't have the same restrictions, that are spreading the virus more, can come to your state, and they can mess up the type of controlled opening that we have to do. When we have a chance to reopen, first of all, it's going to take significant testing and the ability and the staff to contact trace. It's going to take more PPE than we have right now, because as you want to gradually reopen, you're going to need PPE in a lot of different places other than just our hospital systems that we have it right now. You're going to have to look at the specific way that you reopen any specific business or industry, and how it can better comply with CDC guidelines, and how much contact there is with the rest of the world. And it won't be something that's just entirely reopened. It's going to be even phased within that. And then we got to look at who it's reopened to, which is really hard. Remember, even when we're coming out of this and we're trying to loosen up some, those over 60, those that are medically fragile, are still going to be in significant danger. So it's complicated. I talk every week with Eric Holcomb of Indiana and Mike DeWine of Ohio, especially with Governor DeWine, but also with Governor Holcomb. We talked about restrictions as we increase them. We've been talking for a couple weeks about, number one, making sure that we're going to coordinate when we decrease them. You know, we haven't made an announcement like has been made in a couple other places, but I believe we've been doing the same thing as those other areas. I will say that those talks have been great. We have all been on the same page. There have been zero politics. I mean, not even close to anything about it. We have shared ideas about what we have done. We have gotten good ideas from other states, and everybody is trying a couple of different things that we're all trying to look at and model from. And I would expect, though we haven't made any big official announcement, that you will see the 3 of our states at least working together significantly as we move forward. All right, Mandy McLaren, does the governor have the authority through executive order to cut short the required hours of mandatory instructions for the state's K-12 public schools? I believe that answer in a state of emergency is yes. State of emergency provides broad powers to the governor's office, which are absolutely necessary during one of these crises. If so, would I consider exercising that authority, and to what extent? I'll be working with our public schools. We can't let our public schools suffer just based on laws or numbers that applied in a non-COVID-19 world. And we can't let our students suffer from a worldwide pandemic that they have no control over. Daniel.
It appears people are getting antsy. We're ready to go back to their lives. And upstairs, apparently they're working on a coronavirus relief bill that would deal with occupational boards to classify businesses based on how safe they are or not safe, rather than essential and non-essential. What are your thoughts on kind of shifting the way that we think about that to whether or not a business could safely operate rather than whether or not it's essential?
Well, I think the question is based on at least some statements we saw today that certain members of the legislature want to pass a bill where they set up what's decided on when and how things reopen, or try to convey authority in different places. All right, folks, we've been at this. We've been doing this. We have been flattening the curve. So it's who do you trust on how and when we reopen things? Do you trust the governor, led by the Department of Public Health and all of our medical officials? Or do you trust the legislature and lobbyists that are talking to them each day based on monetary interests that are out there? I don't think that that's a hard decision. Our legislative leaders, I know, are probably coming from a good place, but they haven't been at this every day. They haven't run down hundreds, if not thousands, of leads on PPE that didn't turn out but got up the next day to try to do it to protect our people. They haven't had to read the numbers of new cases and the dead we have, that look at the modeling and try to figure out where we are, that work with other states, that talk to our local health departments and have to make really hard, unpopular decisions. I get that they're back in town having a mass gathering right now, which is not a very good example if we're talking about making decisions and leading. But I mean, we have been at this. We have been living it, grinding it out every day. I know folks are antsy, but we want to do this right. If we open up too early, we look at what's happened in Japan and other places. We look at that bump in St. Louis when you compare Philadelphia and St. Louis, which we have, and people die as a result. We're going to get through this, and we're going to get through it together. We're going to get through this the same way we flatten the curve. It's you and me and Dr. Stack and Eric Freelander and all of the experts that are out there based on expert advice with our Department of Public Health. That's how we have to get this thing done. We'll see if any bill comes to us, but I can guarantee you that public health officials are going to provide the guidance of when we open up and what we open up, and that decision will not be driven by lobbyists. Student journalists at Murray State News. Today, Boston University announced it may postpone reopening until January 2021 due to COVID. Several other colleges and universities around the country are quietly looking at doing something similar. Do you think that colleges and universities in Kentucky should prepare to be online and possibly not reopen for the fall semester in case the pandemic is not over by August? That is not something that I'd be prepared to advise our university presidents on now. We have increasing cases. We've been doing a good job of flattening the curve. Our hope is that certainly by August we would be in a very different place, and hopefully with a number of restrictions that have been loosened, if not a lot of them. Again, we're looking at months, not years, but should you make plans for it? Sure. We've seen in many of these pandemics that there's a second spike in the fall. And so there are a number of different scenarios that you could see. One is that this thing lasts longer than we think. I hope that that's not it. The other is you could see us being in a good place and then having a fall spike and needing to do this again for a month or something like that. But being prepared for all those scenarios is important. And I love that we got a student journalist question in today. Phil.
On that same kind of thinking here, the Ohio governor was asked about will there be Ohio State football with 100,000 fans in the stands? Do you think Commonwealth Stadium or Kroger Field will have 61,000 people in it this fall for Kentucky football?
I think the question is about what we see in sports this fall. It's got to be driven by public health and the data that we see that time. In the fall, I think we ought to be really hesitant to have 60,000 people together at something, but we haven't seen exactly where this is going to go. We haven't seen what some of the treatments will turn out to do, and there's different information every day. We can't tell you right now the level of immunity people have as they go through it, or whether they can even get it again. You know, what we see every day is a new story that just hasn't been proven out. So, you know, I think that we play this thing by ear. We make sure that every day we are reevaluating, and that in the end we just make the very best decision to protect our people and to win, to beat this thing on the first try. Cincinnati Public Radio, will you be able to sustain the 250 tests a day? I know states have had trouble getting the amount of tests they needed. Where are the tests coming from? Well, the answer is certainly on the Kroger partnership. I believe that we have the opportunity to do that, to get to the 20,000. And the reason is Gravity Diagnostics, which is doing a phenomenal job for us in the Commonwealth. We got a lot of great labs out there. Let me say that first. We got U of L, who's ramped up bigger and has ramped up big and fast. We've got UK, which is doing that, and we got others. But from the state perspective, I mean, this has been a godsend. Just like every other lab, but for what they're able to do with us directly has been a huge help. And this is the advantage that we've seen in some other states about having a major lab in their backyard. We didn't have any of these, but you know what? For this purpose, Gravity's becoming one. U of L is becoming one. I guess I hadn't thought about it before, but when we look at manufacturing of PPE at a place that we all wish was better, man, our local labs have done a really great job. Joe.
Going back to politics, when you did the line item veto for HB 351 yesterday, it took out the reference to upon recommendation of the Secretary of State for changing the manner of an election during an emergency. He put out a statement saying...
We didn't take out that part. We took out the joint agreement part.
You didn't take out Secretary of State.
So the question is on the Secretary of State, if you need to ask a follow-up on I did a line item veto where because for the first time under statute, the legislature added an additional authority to a separate constitutional officer about how we decide on what we do in elections. Normally it is upon recommendation by the Secretary of State and then a decision by the governor. And what was added by this legislature is it's not upon recommendation and decision by the governor, it's upon recommendation by the Secretary of State and joint agreement between the two. I'm just trying to keep the statute as it always was, the authority as it always was, and at the end of the day, it's my responsibility to do everything I can to defeat this coronavirus. And if it's going to come down to me, I just want to make sure I've got that final decision. And while the Secretary of State and I have been working well, I know I saw his comments, and I'm sorry he's upset, but you know, I've got to do what I've got to do to protect people. I expect that we'll be able to work through it together, but there is no way, especially in June, that I'm going to put our typical poll workers sitting in a room and have them exposed to the coronavirus. If you need to follow up on it.
So there's no way you're going to have in-person voting in June? Did you just say that?
What I said is in June, we will not have, do not see, and I believe the Secretary of State would agree with this, I do not believe we will have a normal, typical election. There may be some need for certain populations based on disability or others to have some way to vote other than other options we're looking at, but right now, I would say I'm very strongly leaning at an election where there is never a line of people, and we don't have primarily our seniors sitting there in the polling location.
Is that decision ultimately going to be yours and the State Board of Elections, or does he have a say
Well,
in how?
the State Board of Elections, the Secretary of State, and our office are all working together, and I believe we're pretty close. Now, I know that there's going to be argument on whether or not the legislature should get to add this new piece and whether I'm a bad teammate by vetoing a new part of the law that takes authority from the governor. I just believe at the end of the day, given the coronavirus, that I need to have the final decision, just like it's been the law forever. I mean, what we saw in the bills that I line itemed was an attempt to take away authority from the governor and give it to other constitutional officers. They tried to say the Attorney General will be the final arbiter of the budget. Never happened that way. Certainly not when I was Attorney General. It's always been the Secretary of Finance. They tried to say the State Treasurer would regulate the state plane, which has never happened. And then here, additional required agreement of another officer. I'm happy to work with everybody, but it's never been more important for the governor to have the authority to take these necessary steps to protect people. Now's not the time to play politics and pull them out in different directions. If they override the veto, fine. I'm out trying to buy PPE to test people to prevent deaths and save lives. All right. Do I believe I currently have the authority to institute full voting by mail or removing other restrictions from voting? Certainly under the law, regardless of what happens on veto overrides, the Secretary of State is to make recommendations to us. I take those very seriously. He is the chief elections officer. I'm not trying to override that whatsoever. I respect his and the State Board of Elections. I don't want to be the chief elections officer. So we'll be working with him. Again, I think we're all in the same ballpark. It's coming down to a couple of nuances. And you know, again, I saw different statements that are out there. It gets a little silly when the legislature comes in. I believe we'll be able to get to a good place. Daniel.
So, do you know how many people have been asked to quarantine after attending large in-person gatherings so far?
The question is, how many people have been asked to quarantine after large in-person gatherings? I would have to get you an answer on that. It ultimately is done by local health departments, and it's not just people who attended large gatherings. You know, today I saw that at least one individual that worked at a long-term care facility was required. There are a couple other stories that I think we're going to see in the next couple days about people refusing to as well. But we'll get you what that full number is. Karen Saar has asked, the president says he holds the ultimate authority to reopen states. My response, this seems to have gotten people in a back and forth that it seems to be more about politics than anything else. The White House has provided guidance. They even say that it's guidance. It's been pretty good guidance about closing down all mass gatherings and about not having elective procedures. I mean, we're all on the same page. You know, governors have instituted the orders, many of them following that, and I don't think that this is going to be anything more than kind of a one-day back and forth. I'll do one more here, and we'll go through one more time. Several nursing facilities in Louisville are now opening respiratory clinics to treat COVID-19 patients to address overflows from hospitals. At least one health system says they still have a significant number of beds. Why are these clinics necessary right now? It is all preparation, and we need every bed and every individual ready to treat COVID-19 patients. Remember, on Trayton Oaks, we had to move 18 people who needed very significant care all in a day. They call something a spike for a reason. It is a significant increase, and our goal here, well, we got a lot of goals, is to make sure our healthcare system is not overwhelmed. So any facility like this that is increasing our number of beds and our capacity is protecting lives. You know, it's part of the reason that we've done what we've done at the fairgrounds, creating a field hospital. I hope that it doesn't have to be used. But if it is needed, the people that would be there would certainly want us to be ready. Phil?
Do you know if any of the Maryville church members are in fact still quarantining, and if not, would you do anything to force them to quarantine?
I don't know. I believe the local health department has the information they need to send letters. Joe?
Do you have a reaction to, looks like the General Assembly, I don't know if they have since we've been here, but they're going to override the veto of the photo ID voter bill, SB2. Do you have a reaction to that?
The question's a reaction to if the General Assembly overrides the voter ID bill. I don't know how somebody gets an ID during the coronavirus when every place you get would be closed. I don't want people to be exposed to this virus because they want to vote. I think that they should be able to vote. And I think that this is a decision being made in a world like we don't have a international health pandemic. Can't they at least wait until the next session when we're not facing this? Why wouldn't you? If you want to pass a voter ID bill, that's fine. But let's do it outside the coronavirus. They can do it next year. They'll have the numbers to override any veto. There's a place and a time for everything. And again, that's just removing the politics of it, right? Is it practical? Can you go in and get an ID? If the answer is no, then you shouldn't do it at that time. Daniel.
So a lot of the questions today have been colored by politics, right? It feels like the gloves have been taken off and the politics are back in play. Do you have any kind of reaction to the fact that there are several statements that have been put out by Republicans today kind of criticizing you and your response to the voters?
The question is, it seems like with the legislature back, there's more politics, and there have been statements put out by maybe leaders of the other party critical of me. I don't care. I'm done with politics. I'm doing what I can to save lives every day. If people try to take my ability away to do that, I'm gonna fight for that ability, because my job is to protect you. At the end of the day, when we are judged by how we reacted to this coronavirus, nobody's going to say it was leader X or Y in the legislature. They're going to hold me accountable, and you should. This is my job in a time of emergency. It hurts me every time we lose somebody. It hurts me every time that I see us having an increasing number of cases. It hurts me that our most vulnerable in our nursing homes have been hit the way they did. I'm not going to get in a political back and forth. I'm not going to engage in any of that. We are in a worldwide health pandemic, and the rest of this state has come together, that have pushed our divisions aside, and I hope that everybody else can too. But my job is to lead, and hopefully to lead by example. So my goal is to not get bogged down in any of that, but to be able to talk to you Kentuckians directly each and every day, and to tell you that we are not Democrats or Republicans. We are Americans fighting this coronavirus. We'll deal with the rest. You know what happens. It's part of our system of government. But my goal is for us to get through this and to get through it together. Let's remember that we got to treat each other with kindness and with compassion, which we could see a little more of in Frankfurt. But we've got to do that all over Kentucky. We've been at this a while. And I know you're anxious, and we all want to be through it. But it's going to take as long as it's going to take. And we do not want to frustrate how well we have flattened this curve. You know, the stories in Kentucky that sometimes we see or hear can get caught up in those that aren't doing the right thing. More of us are doing the right thing than just about anywhere else in this country and in this world. And we are in it together. We are doing it together. And the way that history will look back on us is that you, the people of Kentucky, came together to do the right thing. Let's keep it up. Let's try to stay in good spirits. Let's remember everybody else is suffering from anxiety too, so the nicer we can be to each other, the better neighbor that we can be, the easier we're going to get through this. Now, we're going to close today with a little bit of music. It's pretty creative. And anytime somebody can adopt a Johnny Cash song, I think it's worth all of us seeing and hearing. Thank you, James. Thank you, Virginia. Thank you, Kenneth.
My hands are chapped from washing all the time. Wear my mask each time I go outside. And I hear a sneeze and I have to run and hide. COVID-19, I quarantine. Staying home's an easy thing to do. I find myself alone when each day's through. But after 4 weeks I'm starting to feel blue. COVID-19, I quarantine. Keep 6 feet away from me and mine. I wait my turn to go inside. If the line's too long, I drive on by. COVID-19, I quarantine. Turn on Andy every night at 5. When he says stay at home, well, I don't fight. I keep a green light on this porch of mine. COVID-19, I quarantine. are chapped from washing all the time. I wear my mask every time I go outside. I hear a sneeze and I'd have to run and hide. COVID-19, I quarantine. COVID-19.